My name is Dhanunjaya Lakkireddy. I'm the Executive Medical Director for the Kansas City Heart Rhythm Institute. The Susruta-IST study is an observational registry which essentially looked at sinus node sparing hybrid endoepicardial ablation approach compared to that of an endocardial radiofrequency ablation done in a percutaneous fashion. As you know, the inappropriate sinus tachycardia is a very common cardiac dysautonomic condition that is mostly seen in young women of very productive adult years. This group of individuals range anywhere from 13, 14 years all the way up to 35, 40 years of age. It's most commonly seen in this group of people. Manifest by dramatic symptoms of palpitations, shortness of breath, which really impedes their quality of life, really compromising their entire life. And oftentimes there are no easy solutions in treating these people. There's a lot of work that's been done in the space using beta blockers and the more recent antiarrhythmic drugs like Corleonor. However, radiofrequency ablation has been attempted in a lot of these patients over the last 20 years of our experience, including very early work that was done by the Michigan group and then subsequently by the Cleveland Clinic group. And what you realize repeatedly in this particular approach is the endocardial ablation of sinus node modification oftentimes does not work. And there is a very high failure rate where patients require more than 2 or 3 procedures. And at the end of it, you're left with a sinus node that's completely destroyed with patients requiring permanent pacemakers. And then you have the collateral damage of the phrenic nerve injury because the sinus node sits in close proximity to the phrenic nerve. So when you're delivering radiofrequency energy in that particular location, you have a very high risk of phrenic paralysis. And this often requires epicardial access and then mapping of the sinus node in the epicardial space and ablation of the same, really resulting in suboptimal results with very high complication rates. And this is kind of what we learned over the years. And for lack of a better answer, depending on the intensity of the symptoms, patients are willing to put themselves through something as intense as that. So somewhere along, we realized that sparing the phrenic nerve or the diaphragmatic nerve is important. And since the sinus node is essentially an epicardial structure, and then you have these entire network of sympathetic nerve inputs into the right atrium epicardially, we felt that if there was a way for us to really do a regional sympathetic denervation around the superior vena cava, sparing the sinus node, and around the inferior vena cava, and potentially all across the crista terminalis, this could potentially result in what we call a regional sympathetic denervation of the sinus node, while you remove the pathological inputs into the sinus node and preserve the intrinsic sinus node activity. This technique was initially described by Carlos Diaz-Mundis and Marc Lemaire from Belgium. And so we all got together and we learned and embraced this particular technique and started trying to execute it in patients who have very symptomatic inappropriate sinus tachycardia that are not responding to medical therapy, who have dramatic limitations of their lifestyle. What we found was incredibly reassuring. By doing this endoepicardial hybrid approach and sparing the sinus node, the number of procedures that you require to really get the sinus node rates under control is significantly lower. I mean, with one procedure, you can get more than 90% of these people's sinus rates, heart rates under better control. while you preserve the phrenic nerve and avoid the phrenic nerve damage. And what you also notice is the sinus node is well preserved, and so the risk of needing a permanent pacemaker is also dramatically lower. So we find that with the hybrid IST procedure, you could help a lot of these patients who have inappropriate sinus tachycardia that are currently faced with a very limited choice of treatments and a dramatic reduction in their quality of life. And oftentimes they become so debilitated that their life is completely turned upside down. Our key findings were the hybrid endoepicardial sinus node sparing surgery is safe. It's not only feasible, it's safe, has significantly lower risk of complications, and is dramatically more efficacious in controlling the heart rates, and improving the overall quality of life, anxiety and depression scores, and exercise capacity. I think the take-home message from this study is that inappropriate sinus tachycardia is a very debilitating disease with very limited treatment options. The sinus node sparing hybrid endoepicardial ablation procedure could be a very important tool in the therapeutic armamentarium against the inappropriate sinus tachycardia, which as a disease is very poorly understood, and it has very limited treatment options at this juncture. You have to realize that this is not a randomized controlled trial, and obviously being a clinical registry, it has all the limitations that are very much innate to a clinical registry like this. We really need a large randomized controlled trial to prove the clinical effectiveness and reproducibility of our findings, so that this could be applied to a wider group of people and be offered to more patients across the world. We also need further understanding of how exactly this procedure works. I mean, based on our limited experience and our exploration, we believe that this creates sort of a regional sympathetic denervation, sort of minimizing the abnormal autonomic sympathetic inputs into the sinus node, which makes the sinus node react and put out increased electrical impulses. But what else is in play needs to be further explored. So I think we have hope, and we are moving in the positive direction, but we need more definitive answers and in order to be able to understand this in a better way.